To Bud and Holly Flickinger. Good morning.
Good morning.
Good morning.
Merry Christmas.
Yeah, you too.
Same to you.
Anything on your Christmas list this year?
The holidays off.
Yeah, I think that's kind of how everyone's feeling this time of year.
Yeah.
Yeah. You asked if we had Christmas sweaters. Do you have a Christmas sweater event at your office?
Yeah, we did. We just had ours actually.
Oh.
We did.
Who won?
Her name is Melissa.
Uh-huh.
She's actually the running champion for 2 years in a row now.
Oh, wow.
Yeah.
It's a little difficult to beat her.
Same sweater, or did she do a new one?
She did a new one.
Wow.
Yeah.
Yeah.
We've got some really festive people.
Yes, we do. She added a little extra spice, which made it that much more fun. So.
Nice. You know, I got a call from my pharmacy yesterday, and they said, we don't have your drug, and we're not going to ever have it.
Oh, interesting.
Yeah. Is
What
there
drug?
stuff-
Ask him. What drug was it?
I don't want to say. But
I was
gonna
mean,
ask.
it's
I think it's Ozempic.
they can't, the manufacturer is not making it right now, and it's like on a production halt. or
Really?
whatever, yeah.
You know, it's not an area of my expertise, but from what I understand, and we're talking to a lot of people, it can be really challenging to get the medicines that a lot of people need or want. Either they're too expensive, or the insurance isn't paying for it, or it's not available. So it can be really challenging.
Yeah, that's
And
good.
by the way, I have two pharmacies. A good one, Brown's,
That's my pharmacy.
and about a bad one. I don't want to say it.
You know, I like Browns.
Brown's
yeah,
is
Brown's
a
is
good
a
one.
good
Austin does a good job.
Yeah.
Brown's is the
Yeah, and
Brown's
I've seen
is
Austin
great.
on here.
Yeah, Brown's is great. Well, again, this goes to all of the services that you guys provide in Jackson, and you guys are here to help our community. And today we're going to talk a little about the Early On program. Talk a little bit about that. What is it, and who's it for?
Yeah, that's a great question. So our Early On program is for families with infants to children of up to age 3. And it's in regards to those who may not be meeting their developmental milestones.
The program is for what ages?
0 to 3.
So right off the
good.
bat.
Yeah, right off the bat. Yep. So
Is this kind of like maybe I don't know if intervention is the right word, but an intervention style program?
it is. Yep. So if a child is not meeting their milestone, we can come in and do an assessment, kind of to determine like what the needs are. There's 8 domains that we're looking at to kind of determine what type of support that the family needs. And then it's a home-based intervention that we go in and provide services to the family.
A lot of first-time parents, they think, oh my gosh, I don't think they can hear me. They're not talking yet. They should be walking. At what point does it become, it's just normal, and but when should they actually seek out some intervention?
Yeah, that's a great question. So it can be very difficult to determine, especially in those early years. And there's a lot of things that we take into consideration. Prematurity is one, because that can delay milestones. But if a parent is at all concerned, they can make a referral at any time, and we can help with that assessment to let them know, hey, your child's doing well, and this is great, or maybe we can provide some further intervention for you.
And you guys do that in the home?
Yes, yep.
Wow.
We can do it in the home, we can do it in the community, pretty much anywhere that the family is comfortable. We do some office visits as well, but often, mostly where the family and child is most comfortable.
And you stay with the family. You'll keep coming back.
Yep. Typically on a monthly basis. So the point of the program is to help parents learn how to best support their children in developing these milestones. So we give interventions that they can then step in and kind of work on it with the child. And then each time we come back, whatever new is going on, we work with them on here's a new option for you to work with your child on.
Wonderful service. And it's a time too in people's lives where it is so scary, and you really don't know. There's a lot of worries,
For sure.
right?
Yeah,
do you
well,
remember?
people think there's something wrong.
Well, yeah. I mean, everything. You always think something's wrong because
Yeah.
at that age your kid cannot tell you what's wrong if anything's wrong, so you
Right.
just assume the worst, right?
Right. Yeah. Well, and then there's always that family that brags about how
the
advanced their child
Yeah,
is.
the 2-year-old that's going to boarding school.
Yeah.
So you got to try and keep up with that.
Yeah. Well, you wouldn't believe this, but I think right now, today we have maybe 4 people out sick.
Oh, at work, yeah.
It's
for
been
sure.
like all week, and it's different people.
It's actually been going on for a few weeks.
And we encourage people not to come to work sick unless we call you in anyway.
Which we do. No, I mean, we don't. I'm kidding, we don't.
No.
But it's been that, I mean, from kids to adults, it's just one of those. I've seen a lot of this, like, kind of hacking cough going around, or this lingering cough, but it has to do with what's going around, the typical COVID RSV type stuff.
Yeah, it sure does. And I think that, it's been with us for a long time. Ever since we humans have kind of been around each other, we've been passing along some type of cold or virus. Of course, up until about 2019, flu was the big one every year we talked about. We also talked about RSV, but I think we're talking about that even more now because there's a flu or an RSV vaccine available for people older than 60, pregnant women, and infants can get vaccinated as well. So that's very protective because RSV kills thousands of people every year. But we also have flu circulating, of course, and COVID-19 since 2020. Those three things look very similar to one another in regards to coughing, headaches, fatigue, sneezing, runny nose, sore throat.
Right.
They all share those same symptoms. And it does pass along from person to person, and people are generally contagious 4 to 8 days, depending on the disease for all of those too.
I love how everyone thinks they know how long they're contagious for.
Oh, I've heard it all.
I
I've heard,
it's
well,
okay,
I'm
I'm
already
not
sick,
contagious.
so I'm not sick.
Yeah.
And you can't get sick from me.
Well, and people really, they don't know.
Of course they
can't-
don't.
They don't know.
How could you possibly know?
And a lot of people, they're passing the virus even before they have symptoms.
That's right. So flu is about 24 hours before. RSV is up to about 48 hours before, and so is COVID. So before you get sick, and that's why one of the big challenges for COVID-19 when we were doing a lot of good contact tracing is, okay, where were you 48 hours before you were sick, and who were you talking with? And because people are contagious at that point.
I saw you just get nervous. You're sitting next to us. We may
No.
all have RSV in a couple days, and you're getting a little jumpy.
No, I'm fine. I'm vaccinated and immune.
Now, not too many people are getting the vaccine. I mean, that's just national news. It's just data. I think 17%. But the vaccine is available. The RSV and COVID vaccine is available right here if you'd like to get it.
Absolutely. We have it at the health department. Henry Ford's a good partner. This Monday, I got my flu and COVID vaccine.
Nice.
So, talk to your healthcare provider. Come talk to us. And you're right, all flu, COVID, and RSV are all available.
And it's not too late to get the flu shot.
It definitely isn't. I'd recommend it really through January or February. Some partners will even recommend it through March because some years we've had March, April, May flu increases. In the hospital right now is seeing cases. I just talked to Dr. Catan, who I believe was on the show on Monday, and he was telling me that there's 25 hospitalized COVID-19 patients and upwards of about 60 patients with flu, RSV, or COVID in the hospital right now. So that'll probably continue throughout the holidays. And just as you mentioned, if you're sick, please stay home.
Yeah, it's a third of the people in the hospital right now have respiratory illnesses. Wow. All right, so early on, if someone wants to find out more about the program, do they need a referral? Do they go
They can make a referral for themselves. Anybody can make a referral. It's just 1-800-EARLYON.org. You can put in a referral.
All right. Send us over those Christmas sweater pictures.
Yeah, we'll do.
Yeah.
Good to see you both. Thank you, and Merry Christmas.
Same to you.
Merry Christmas.
Jackson County Health Department Deputy Health Officers Holly Flickinger and Matthew Budd. More of the morning show after this.